So I'm going to talk about the University of Liverpool drug interactions prescribing tools in the areas of HIV, hepatitis, cancer, and COVID-19. The problem we face is with HIV, 37 million infected worldwide, hepatitis C, 70 million infected worldwide, cancer, 1 in 4 deaths in the UK from cancer, and COVID-19 with the latest estimates of more than 40 million cases globally. Many of the drugs used in the treatment have a high propensity for drug-drug interactions. We need to consider the harms, and the harms from drug-drug interactions are documented in some studies and case reports as shown in this montage of publications covering both antiretroviral therapy and direct-acting antivirals for hepatitis C. Pregnancy, for example, with the loss of contraceptive efficacy, cardiovascular complications, Cushing syndrome, corticosteroid overemphasis, and then fatalities in people who use drugs. Our story is we started out in 1998 with the first HIV charts as a result of the advent of protease inhibitors with boosters. We had a fully interactive website in 2006 with an international editorial board in 2009 and the implementation of a grade system for the strength of recommendation and the quality of evidence. We redeveloped the HIV site and with the app in 2011 and a hepatitis site and app for both iOS and Android in 2011. We produced in 2017 a cancer website and app, and then in March 2020, a COVID-19 website with an app to follow. Our mission is to provide clinically useful, reliable, comprehensive, up-to-date data, which is for drug interactions, and these resources are freely available to healthcare workers, patients, and researchers worldwide. We have a strength of recommendation based on a color coding with quality of evidence from very low through to high. So for example, in the HIV site, you can search for a primary drug, in this case, bictegravir FTC TAF, a co-medication, in this case being omeprazole, and it gives you a commentary of the interaction. Here it is green, so no interaction expected, with the evidence being very low. A PDF report can be downloaded and put into the patient notes. But if, for example, you get a red color, this is for darunavir cobicistat as the primary HIV drug with clopidogrel and dabigatran. You can also search for an alternative to the red-colored drugs. And in this case, you can see a list of anticoagulants and antiplatelets, which potentially could be used as alternatives. You can also search for a number of primary drugs. Here we have 4 integrase inhibitors with a number of co-meds that a patient may be on. And you can see the more risky areas for drug interactions. In this case, because of the booster, you have more drug interactions with elvitegravir cobicistat. The HIV site, the statistics, a total of 42 antiretroviral drugs or regimens with 800 co-meds. 29,000 users visit the site each month. In the first part of this year, over 2 million interaction searches were made from a number of different parts of the world. Guidelines were in the European guidelines, and these are the latest guidelines from October 2020. For the hepatitis drug interaction resource, there are 23 drugs for treating both HCV, HBV, hepatocellular carcinoma, and primary biliary cholangitis, with 800 co-meds, each month 14,000 users, over 1 million interaction searches so far in 2020, with a reach to many different parts of the world. Also in the EASL guidelines for hepatitis C, charts are taken from the website. The COVID site launched in 2020, 100,000 visits in the first month, 20 experimental COVID therapies and 500 co-medications. Most frequently searched COVID drugs being remdesivir, hydroxychloroquine, lopinavir, ritonavir, chloroquine, azithromycin, with a worldwide reach. We have translations for hepatitis into Japanese, for HIV into Spanish and soon to be Portuguese. Electronic prescribing is also something that an API from the database of the Liverpool resource can feed in to different electronic prescribing systems. And here we have Malago Hospital in Kampala. Our users say that this is a very important resource. So World Health Organization for HIV say that we rely on the information provided to develop global guidelines for treatment and care of people living with HIV. And similarly, from the liver community, the EASL guidelines use the site, and this is a major influence on HCV treatment practice worldwide. And so my acknowledgements are to a wonderful team who do so much of the work providing up-to-date resources, not only the websites and apps, but also many other prescribing resources for therapy areas in treatment selectors, and also different resources for individual patient conditions. Thank you.